Recently, we announced the start of the CUV-151 study, running in parallel to further evaluate human volunteers with skin types 1 to 3, looking at the natural repair capacity. The best way we try to explain this is through the socket and plug model. Our technology, melanocortins, are natural. They are our body's own hormones, are the perfect plug, which fits on the socket, the receptor of the human skin cell. This perfect match of plug and socket provide the natural process of photoprotection, the natural cellular response, and sufficient response to assist the DNA repair process following sunburn or prolonged light exposure. One may ask whether other plugs would fit this socket, and the answer is yes, but this would not give an adequate or sufficiently strong and long response. In simple electrical analogy, if one has a socket of 3 holes, of course a plug with 1 or 2 holes would fit too, but it will not give the desired electrical signal required. The same goes for the human skin cell. CLINUVEL has the plug and socket model to follow through our DNA repair program. In our CUV-151 study, the use of alpha-melanocyte will be evaluated in up to 10 volunteers. We have done this several times, but this time we are looking at more specific markers of skin damage and repair due to UV. As global leaders in photoprotection, we have been the first and only company to have commercialized a systemic photoprotective drug to protect porphyria patients from the blue-green light spectrum as well as UV radiation. These patients in Europe and US lead now a life they never could imagine. They do things they never could and participate normally in society, whereas before they were isolated and left alone at home. In XP, we see the same social isolation. Patients gradually become very sick and lose anatomical parts of their body due to a high number of skin cancers. Then in parallel, we have developed the next generation of topical photoprotection, polychromatic screens protecting us from visible and invisible spectrum of light, aimed at those at highest risk of skin damage and skin cancer, and those who experience long-term outside exposure. This trilogy completes our program. I look forward to bringing further updates from this program later this year.